Hi, I'm David Quinn from the University of Southern California. I'm reviewing non-prostate genitourinary cancer at ASCO 2021. What was interesting this year? Well, in the first line, we saw updates for KEYNOTE-426, which is the study of PEMBRO and axitinib versus sunitinib with 42-month outcome, which showed continued overall survival benefit with a hazard ratio of 0.73 and is particularly prescient in intermediate poor risk patients. We also saw detailed quality of life study from the CLEAR trial, and this was presented by Dr. Robert Mozer for quality of life data, most particularly comparing Pembrolizumab and lenvatinib to sunitinib, where the len-pem combination, as we call it, showed superiority or equal quality of life to sunitinib across a range of spectrums. In the other part of the study, the quality of life for lenvatinib everolimus was not so good compared to sunitinib overall. So what does all that mean? Well, we have now several regimens we can use, and analyzing the quality of life data helps us select treatments for individual patients in our practice, and that will evolve in time. We had some interesting data for non-clear cell with a combination of cabozantinib and Nivo in mainly papillary patients, but also undifferentiated and TFE translocation patients, where there was significant activity with a response rate of 47.5%. This compares to single agent activity with cabozantinib or a PD-1 inhibitor of about 25%. And so from that perspective, it'll be a question of whether we want to use that combination or individual drugs in sequence. And then in the adjuvant space, we have interesting data with Pembrolizumab given after nephrectomy for high and very high risk localized renal clear cell cancer, including some patients that had metastases resected, showing a significant disease-free survival benefit at the first interim analysis, and with overall survival still being immature. And we may be getting close to an additional drug we can use in the adjuvant setting on top of sunitinib, which is already approved by the FDA. In the context of urothelial cancer, there was follow-up on the JAVELIN 100 bladder trial with some molecular analyses, and this suggested that luminal patients based on subtype derived from next generation sequencing do not do as well with the addition of Avelumab. We've seen this before in some advanced checkpoint inhibitor therapies, and it may be that this analysis helps us subtype patients early in their disease, either in the neoadjuvant setting or the metastatic setting, and select therapies. And several trials are in process, most particularly one headed by Seth Lerner at SWOG. Thank you very much. I'm David Quinn, and happy to provide this commentary for you on ASCO 2020.